Hi there.
Hi.
It's Constipation Gurus, Annette and Jess. We are just coming on really quick today to talk about possible medical diagnoses that can be contributing to your child's constipation. So that's what we're talking about today. And to start off, first with a little research, 1 out of 20 visits that you make to the pediatrician is for constipation.
That's a lot.
That is a lot.
That's a lot.
A lot of visits there, and with all the different things that can be causing constipation, there's a lot to look at. So we all know that the fluids you drink, medications, nutrition, your pelvic floor, all these things can be contributing to constipation, but along with that, there's a lot of different medical diagnoses that can also contribute as well.
Yeah, so like Annette said, we know there's a whole host of reasons kids are constipated and struggling with infrequent stools. We know lots of the kids out there are holding, may have a fear of toileting, those things. And we know obviously diet, nutrition plays a big role in constipation. But today we're focusing on like the real medical diagnoses that a child might receive that can cause some constipation. So the first one we're going to talk about is Hirschsprung's disease, which is pretty rare, honestly. It is when the child is missing some nerve cells in the end of their bowel. And because of this, the bowel doesn't work properly and it doesn't signal, to empty the bowel. And so a child will get really backed up and constipated. This is something that would be diagnosed like really early on. So like newborns often will leave the hospital with this diagnosis or within the first like few weeks of life. So if you're out there and you have a 10-year-old and you think maybe they have Hirschsprung's, they don't, you would have found it most likely by now. And it's pretty common as well with kids that have Down syndrome, and it is resolved with surgery. So that is probably like the first reason, medical reason kiddos would be suffering from constipation is Hirschsprung's disease. So if you are interested in learning more about that, you can check that out. Another common reason kids might be dealing with constipation from a medical standpoint is they have undiagnosed celiac disease. And this is near and dear to my heart as I grew up with a kid with undiagnosed celiac disease. Celiac disease it has become more prevalent. Doctors are testing for it more. You can discover it with a simple blood test. And what happens when someone has celiac disease is they are immune or allergic to gluten. They have a gluten intolerance, right? And the small intestine has villi in it. They're like these little fingers, and that's what absorbs all the nutrients from your food. And for someone with celiac disease who is eating gluten, those villi get kind of cut off, right? So like someone's intestines that doesn't have celiac disease looks like this with all these fingers, and someone with celiac disease who is eating gluten, their intestine looks like this. And if your child has undiagnosed celiac disease and is still eating gluten, there's a good chance of some malabsorption that goes on and a inability to absorb a lot of nutrition and nutrients. And this can also cause constipation because we're not getting the full nutrition from our food, and food is kind of for lack of a better word, kind of piling up. Our waste is piling up and not being absorbed properly. And so this can cause some backup and some constipation. So that's a second reason why, a medical reason why a child would be constipated.
Okay. Yeah. So another reason would be a spinal cord or brain injury. And with that, you're just not getting the signal. So your bladder may be full, or your rectum is full of poop, it's ready to go. It's not making that connection up through the brain, so you're not getting the signal. So therefore you're constipated. Another diagnosis would be hypothyroidism. And with that, pretty much everything just slows down. So you have decreased motility going through the intestines, decreased digestion, and decreased elimination. So that just pretty much slows everything down, and so then you get backed up. And that's actually a pretty easy test. You can just get a blood test done, and that's able to tell you if you're hypothyroid or hyper.
And I would say celiac disease and hypothyroidism are two tests that I usually suggest right off the bat, especially if there's any family history of either of those things. When I'm working with a kiddo with constipation, I usually suggest those two tests right away, just to rule them out or rule them in. While going gluten-free, if someone has celiac disease, doesn't seem like it's the easiest thing, it actually is not that difficult, and there's no medication a child needs to take if that's the case. Hypothyroidism, again, it's not huge changes to the diet, but there is medication that kids can take, and that takes it. So those two things, like if we can rule them in or rule them out, that gives us a good place to start pretty quickly to helping a kid with constipation. And I wanted to mention too, like obviously a spinal cord injury or a brain injury, again, those are things that you would know, like a trauma happened to your child and you would know those things. So there wouldn't be any guessing or wondering what's going on. Same with any kind of anatomical abnormalities. You know, there are times when sections of the bowel can actually drop into the pelvic floor and cause a blockage from that regard. Again, if something like that were to happen, that would be discovered pretty quickly for a kiddo with constipation. So if your child suddenly is getting backed up and having other GI challenges, a gastroenterologist would be able to rule that in or out pretty quickly and make any adjustments that, you know, anything that needed to happen, often surgery in that case, to correct that. So that is another reason. And the last reason we're going to talk about today is diabetes. So if your child has type 1 diabetes, you would also see other signs and symptoms like increased thirst and increased urination. And often kids with type 1 diabetes have a kind of an event that happens and they end up in the hospital, and lo and behold, their blood sugar is really, really high, and they're diagnosed pretty quickly. It's not like ongoing symptoms for a long period of time. Once you are showing symptoms to actual diagnosis is a pretty short time for diagnosing type 1 diabetes. But when someone has diabetes, this can cause some damage to the nervous system. And if the nerves within the GI tract and the digestive tract do get damaged, this can also cause a little bit of constipation as well. So that was, let's see, 1, 2, 3, 4, 5. Those are 6 medical reasons, medical diagnoses that a child might experience and be diagnosed with and experience constipation. As we mentioned in the beginning, obviously, diet, fluids, any pelvic floor, withholding, all of those other things are other reasons kids are constipated, and we've talked about a lot of those. But we wanted to highlight some of the medical diagnoses that cause constipation. So hopefully this was helpful to you all. We would love to hear any comments that you have. We would love to hear why your child is constipated. Maybe it's one of these medical diagnoses, but maybe it's something else. So if you want to comment below, that would be amazing. We would love to hear from you. And any questions that you have out there, we're always willing to answer. And lastly, I think we should talk about our poop boot camp. Yeah, we still can't say it well. Poop boot camp. We actually exceeded our number of initial registrations, and we've opened up just a couple more slots. So if you have been wondering about the poop boot camp, thinking about registering, now is the time. It starts January 22nd, goes for 6 weeks at 1 o'clock Eastern time. It's live 6 weeks with us. Yay. It's going to be so fun. We're going to have a great time. We're going to give a lot of good information. So if you have been waiting to register, now's the time, because we just have a couple of slots left. Yeah, I think that's it.
That's it.
Good.
All right.
All right, everyone. Be well. Let us know if there's anything we can help with, and have a great day. Bye-bye.
Bye-bye.